Excited to have you all here today, and I'm excited for Hiral Soni's presentation on which is titled Enabling Healthcare Data Collection Using Chatbots. Very excited to learn more about some of the cool work we've been doing in this area, and yeah, we'll turn time over to Hiral, and when she's done, we'll open up the floor for discussion and questions.
I'm Hiral Soni. I work with the research team as an innovation associate, and much of my research is focused on chatbots in healthcare data collection. I just wanted to introduce you all to chatbots, some different use cases within healthcare, a little bit about DocBot, which is a data collection chatbot a product under Doxy.me's umbrella, as well as I'll talk a little bit about how DocBot can help Doxy.me providers with data collection. And I'll be also continuing next month and talking about research that we have done so far and some case studies from Doxy.me providers in the next presentation. So we all know, we all interact with chatbots these days. They are everywhere. A lot of applications are within e-commerce, sales, customer service, even Doxy. Like we have the DoxyBot that talks to our customers before they can get to one of our amazing customer service employees. And so they're everywhere. So even if it could be conversational chatbots, or even at our homes, like either Amazon Alexa or Apple Siri, we have been relying a lot on chatbots these days. So what are some of the reasons that chatbots are growing in various fields? They overall provide an intuitive user experience. There is a lot of, compared to just getting some information online, they provide a conversational, engaging experience. They mimic the human conversation to the user, and people feel like they are talking to an actual person rather than just finding information by themselves. Overall, studies have reported, both healthcare and non-healthcare research has reported that chatbots have higher usability, higher ease of use for patients, and more satisfaction ratings when it comes to completing tasks or finding information, etc. The higher ease of access. Chatbots are available 24/7, so people don't have to wait for a customer agent, or they can just at the ease of their fingertips. Chatbots can be used from mobile phones. Today, a lot of people prefer to, 85% of the people find mobile information online, and over 50% of the people find health information online. We see like over 50% of people use telemedicine or Doxy.me online. So there's just that ease of access of getting using or getting information from anywhere the person is. At the same time, there's reduced burden, so that basically reduces the burden on the user. They have the mobile phone, or they can use it anywhere and get the information they want, or they don't have to wait for the customer agent to find some general FAQ information or something they need. So it overall reduces burden on the user, as well as the companies, the overhead on the companies, as well as it reduces the costs. You get the experience of talking to a human, but that's basically that there is no cost of onboarding the human or training them, so that overall reduces the cost. Chatbots are large scale, so rather than just interviewing a person or just talking to one customer service agent, chatbots are scalable, and they can talk like multiple people can use information at the same time. So these are some of the reasons chatbots are just growing up in various industries, including healthcare. And some of the applications within healthcare, when we talk about chatbots, we are more we often think about getting some information online or getting some help online. A lot of similar applications are there in healthcare, one of which is support for diagnosis. So a lot of these chatbots, what they do is provide just help patients or individuals guide through screenings towards specific symptoms. If they need some information about provider, just going through quick questions about their health conditions and if they should see a providers. A lot of screening related chatbots. For example, this one is a COVID-19 chatbot, and we've seen a lot of applications like this over the past couple of years, that it just screens patients for their health conditions, their symptoms, and overall provides a recommendation if they should get screened for COVID, if they should get a test, etc. Um, uh, Prevention is another category. Chatbots in this category provide more of coaching, health education, and information. So the screenshot that I'm showing, it's a cancer chatbot, and it just provides people with information for different types of cancer, some education. Patients can interact with them, ask questions of things they would like to know. A lot of times coaching, so they provide personalized. Patients can set up their personas, and these chatbots often used in eating behaviors or like nutrition. And even for older adults, just as a support chatbot. So they provide them just coaching, guide them through the various things, activities, just be a caregiver for them. Another thing they're used is in therapy these days. So the screenshot I'm showing is a chatbot. It's called Voibot. It's a mental health service chatbot. It's an artificial intelligence-based chatbot which basically interacts with patients and provides them with different course of actions based on guidelines. And the various treatment interventions like cognitive behavioral therapy, CBT. A lot of chatbots are used based on those principles to provide patients with comfort and services they need. Um, in addition, chatbots, a lot of applications among healthcare is for administration. For example, scheduling an appointment with your provider, collecting insurance details or payment information, just getting some other administration help when the clinic is closed, etc. And one of the less known application within healthcare these days is patient-reported data collection. As we know, so patient-reported data outcomes is collecting patients' healthcare information, for example, medical history. This example is from one of Brandon's other product, which is itrunsandmyfamily.com, which uses chatbot interface to collect information on patients' hereditary cancer risk, and then provides them with a risk assessment report. This is one of the new novel applications of chatbots in healthcare field. So when we talk about patient-reported data, patient-reported data is important, and it's a critical element of providing high-quality care. For providers, it just allows a patient-reported data could include their intake information, clinical assessments, such as for mental health, GAD-7, which is an anxiety assessment, and over the time, just tracking this information allows providers to get an actual picture of patient's condition. But today, how these data are collected is through paper forms or online forms. I'm just showing you some example of paper forms here. As you can see, there is just so much information. They can be very verbose, dry, non-intuitive, and very error-prone. they often lead to omissions and inaccuracies in data. Even online forms are just online forms. It could be that forms within the EHR or just any other application, for example, Google Forms, like providers are using Google Forms and other tools to send out assessments and for intake forms. But all these methods are often verbose. Patients do not understand or comprehend information correctly, and if they don't have much help to finish the questionnaires. In addition, paper like just getting the paper data forms, scanning them, it requires a lot of human efforts. So it could be costly as well. A lot of online tools these days, for example, Google Forms, they are not often secure or HIPAA compliant, but providers are still using them. One of the ways that could help is just talking to the provider in person, or providers collecting data from patients in person, or virtually by talking to them via interviews or verbal conversations. But this still requires a lot of human efforts, resources, and providers' time with the patient, or a staff's time with the patient to get all this accurate information. So overall, these are burdensome and costly today. Um, what is a solution for that? Chatbots. So we can use chatbot to increase the scale, with human conversation, get information, collect information from patients, as well at the same time reduce the overhead as well as the cost for the providers, and collect data in a better way. So one of such application is DocBot, which is a product under Doxy.me's umbrella, which mimics human conversation to automate patient data collection. It is mobile optimized, so it's available when and wherever the patients are, and it allows to capture quality patient data. It's easy to use for both patients and providers. Patients can use them on mobile, any devices. It is quick to implement. It is simple like Doxy.me, and also it is secure. It is HIPAA compliant. So a little more about DocBot. So it is a mobile-first approach. As I mentioned previously, a lot of patients access health information online these days, and about 70% people want to access all their health information in digital ways on their mobile devices. So DocBot is designed as mobile first, and it is fully customizable. For example, when it comes to branding of the clinics, different colors, different themes, avatar of the chatbot. It could be either like a curated picture, or even the picture of their provider, so they feel familiar with the chatbot. Similar to Doxy.me, the chatbot only uses, there is a common link that the providers can use to send to providers and complete assessments. I'm going to post a link in our chatbots in the chat later, so we all get, like, if you guys want to try DocBot, you can try it. Other than that, it is web-based and secure, but also provides multi-platform support. So it's not only on the mobile phones, but they can also access it from desktop, laptop, even directly from Doxy.me. Today, if you guys know, we have a check-in process, which uses DocBot, as well as we have within Doxy.me, we have the at the end of the call, a call experience survey, which employs DocBot for patients to give feedback about the call quality, audio, video connections, etc. Also, there are multiple ways in which providers get results securely from DocBot, one of which is a HIPAA-compliant email. If, let's say, providers have a HIPAA-compliant Google Suite, so we can directly send results to their email along with all the information, as well as what DocBot does is, if you see the if you see below, it allows a lot of this assessments required scoring, which is not possible on paper forms and online forms. And I'm going to be talking a little more about that afterwards. So DocBot allows us to score assessments, provide recommendations for providers. So it just reduces the redundancy in their work and provide easy access to information. Another way we have is secure PDF via email, sending via email. So let's say a provider does not have a secure HIPAA compliant email, but then they can receive a normal email from DocBot, and the results are within a secure PDF document. A patient portal or database delivery from DocBot. Patients can complete an assessment on DocBot, and we have the capabilities that the results can directly go into their patient management system and the way they want to store it. It does require help from their IT team to set up the API on their side, but it's doable, and we already have providers that are using DocBot this way to get results, as well as one of the new features that we just released is DocBot provider portal. This allows providers to send an assessment, view the results of their patients, and it has providers can sign in using their Doxy.me login, so it's single sign-on. And they don't have to create 100 different accounts or remember different credentials. So also what we have is on the DocBot website, we have a free assessment library where providers can choose an assessment, send to their clients, and directly receive emails as secure PDF or secure email in their inbox. So that's live today, and we have about 20 different bots for focusing on mental health, child well-being, physical health, medical history, etc. And so I just wanted to show you, it is a lot of, when we talk about chatbots, we often feel like chatbots are machine learning based, AI based, but that is not the exact case with DocBot. DocBot is basically like a survey tool where you can go and design the chatbot and the interactions, and you don't need any technical knowledge for that. So this is the current version. It is an internal tool for Doxy.me right now, but this is the current version of our DocBot workshop. If you see, we have different types of response options, from button choice to text to numeric input. Users can customize what the patient should see. For example, if you see the response option is okay, and in the preview you can see the button says okay, so that's what patients would click. The text that patients are going to see, as well as you can set up behaviors, which is basically the logic that would guide the patients from one step to another. So this entire process is rule-based. So with that information about DocBot, how can we help our Doxy.me providers today? So in February, I did a survey with Doxy.me providers to just survey and interview with Doxy.me providers about their current processes. So Alexa Narma and I did about 40 interviews, and overall their process looked like our providers also use either verbal methods of communication or online forms through their EHR, for example, Simple Practice, and still, like, some of our providers send mail-in forms, so they would actually go mail paper forms to the patient fills them out and then sends it back via a mailing service to the provider. So you see, there are a lot of challenges here, and a lot of steps when it comes to collecting patient data. So from there, what they do is, because these systems, paper forms or some of the online forms, they cannot score patient's assessment. And I mentioned like a lot of these, for example, this example of GAD-7, it has 7 questions, but every response action has a different score. So providers need to go and score these individually by hand. And today, hand scoring is one of the leading causes when it comes to medical errors. But after they do this, the next step is looking at a reference range. What does the score mean? So for example, GAD-7, if the score is between 0 to 4, it means minimal anxiety. So, and every different assessment has a different interpretation, and sometimes also subscales and other interpretations within a one scale. So that's what they do. And the last thing is chatting. They need to store the scores and information somewhere. So they either write it in the paper form, they have to scan it, store it in patient's file. Otherwise, even tools like Simple Practice, they don't allow providers to score the assessments at this time. So this is what I've experienced in the free version. But so often providers would go to the clinical notes and end the score as well as interpretations. When we ask them if they, um, okay, about their satisfaction with the process, most of the providers were moderately satisfied with their current process. They felt there is a lot of redundancy in the process. It just takes a lot of time for them to complete the information, there are medical errors, as well as it reduces time from their, it takes away time from their direct care with the patients and resulting in poor experience. When we asked them what they want, so they said, yes, it would be helpful if they can automate the data collection process within DocBot, and why. So it would help them increase their time with direct care, increase the efficiency of the process, get quick and objective results, as well as allow them to track the progress if there is some kind of automation. So with that, how can we help these Doxy.me providers, and what are some of the use cases that DocBot can help with to our providers? The one of first of all, which would be paper intake forms and evaluations. So DocBot already has a generic intake form, but we can customize this intake form for various organizations. So providers can directly send the DocBot link and get all the information. From patients. Another application could be consents and e-signatures. DocBot can collect remote consent, as well as telemedicine consent and e-signatures from patients, and send the data consent form to providers. In addition, remote monitoring, so assessments, evaluations related. We have a proprietary, we have partnered with a proprietary scale, which is the ADO scientific scale, which is an emoji-based scale for mood assessment, behavioral health assessment. In addition, we can measure stress, mood, patient's activities, screenings, for example, standardized assessments, etc. So these are some of the use cases for Doxy.me. And lastly, we're talking a lot about DocBot, but DocBot, it's not just a tool, it's an evidence-based tool, and it is backed by research. Brandon was awarded a Phase 1 STTR, which is a Small Business Technology Transfer grant from the National Library of Medicine in 2020. It is a Phase 1 grant, so basically it means that we demonstrate the feasibility of the product in this phase. So our goals were to demonstrate DocBot's feasibility as an effective data capture tool for clinical research. The total funding was $252,000. And we aim to understand, what are the current barriers and facilitators in data collection today. And from there, how can we evaluate and refine DocBot designs, as well as understand how it compares to different tools. For example, in our case, we did a study where we compared DocBot with an online form and understood users' experience and satisfaction. So All of these results are going to come in next month's presentation. I'll continue presenting on my research about patient perceptions of DocBot versus online forms, as well as a study where we did understood the perceptions of DocBot versus online forms and paper forms, as well as I'll be talking about a case study from one of our early adopters, who is a mental health provider and is using DocBot with their patients along with Doxy.me. So that's coming next month. And yes, so these are some references I have used. As I mentioned, I'll post the chat so you can try DocBot in the. And that's it for today.